So I'm going to check my patient's chart, check for allergies and code status. I'm going to gather my supplies. I'm going to perform hand hygiene and put on my gloves, clean gloves. I'm going to go in. I'm going to introduce myself, say hi. My name is Patricia. I'll be your student nurse today. Can I please have you verify your name and date of birth with me?
My name is Naomi. My birthday is August 6, 1989.
Okay, I'm just going to verify your bracelet. So today I'm going to perform a head-to-toe physical assessment. I'm going to look, listen, and feel, but nothing should be uncomfortable or hurt. First, before we do that, I'm going to provide privacy with the curtain, and I'm going to provide comfort with bed positioning for you and I. Okay. So before we get started, I verified your vital signs before I got in here. Your blood pressure, your heart rate, your temperature, and your SpO2 levels all look great. Can you verify your age for me?
I'm 30 years.
Your gender?
I'm female.
Okay, and how about your height and your weight?
I'm 5'3" and 140 pounds.
Okay. Do you have any allergies?
No, ma'am.
Okay. How about any pain right now?
I don't have any pain.
That's great. Thank you. So, before we start, I'm going to ask you a few questions we have to ask everyone. What day is it today?
It's Wednesday the 25th.
Okay. And where are we at right now?
At the hospital.
And what are we here for?
I'm here for some tests.
Okay. So while the patient was talking to me, I'd be assessing the relevance, the content, and organization of their responses. And then I'd also be assessing for their quantity, pace, volume, and clarity of their speech. Okay, so now we're going to check your groom and your hygiene and your posture. So I can see that you're clean and well kept, and that you're standing up straight in bed for me. Okay, so next I'm going to check the size, shape, symmetry of your skull, and then your scalp, the hair condition, texture, and distribution. Okay, next we're going to check the symmetry of your face. So I'm going to have you raise your eyebrows for me, and then close your eyes tight, and frown, and then smile with your teeth showing. Good. And then I'm going to check the hair distribution and alignment of your eyebrows and your eyelashes. Okay, so now I'm going to check your eyes. I'm going to check the sclera, which is the color of your eye. And then I'm going to check perla, which is to make sure your pupils are equal, round, and both reactive to light equally. And I'm going to check for accommodation. I'm going to have you look past the pen light, and then I'm going to look straight at the pen light. Make sure your eyes are accommodating to the distance. It's good. Follow the pen light. And then I'm going to look at your nose. So we're going to check externally, make sure there's no discharge or any nasal flaring. And then I'm going to take a look inside of your nostril. And both, I'm going to check your septum, make sure there's no redness, swelling, masses present. And then I'm going to have you help me check your patency of your nares. So keep your mouth closed for me. Press down on one nair. Breathe in with the other. And try the other side. Perfect. Okay. Now I'm going to check your outside of your ears with a pen light. I'm going to check for any cerumen buildup, any drainage, or any lesions. Make sure there's no hearing aids, and if there are, I'm going to note that. Good for both ears. While I'm talking to you, I'm going to assess your ability to hear me at a normal volume. Then I'm going to check your lips, and your teeth, your gums, your tongue, and your palate, all with the pen light. I'm going to check for color, dryness, any missing teeth, and if you have dentures, if you do have dentures, I'm going to see if they're partial or full sets. I'm going to notate that. Okay. So now I'm going to check your trachea, make sure it's at a midline position. I'm going to look at your thorax and make sure there's no distress or asymmetry present. Next, I'm going to listen to your heart sounds. I'm going to start with the aortic area for 10 to 20 seconds, and the pulmonic for 10 to 20 seconds, the tricuspid for 10 to 20 seconds, and then the mitral for 10 to 20 seconds. The mitral I can use as the apical pulse as well. I'm going to listen for a full minute. And then I'm going to listen to your lung sounds. We're going to go in a systematic zigzag pattern, 6 spots in the front. You're going to take a deep breath in and out each time. 4, 5, and 6. And then 2 laterally. 1, 2 with each breath. And then 1 breath, 2 breath, And go to the back, do the same thing, systematic zigzag pattern, in 8 spots. 1 breath, 2, 3, 4, 5, 6, 7, and 8. And then I'm going to palpate the interior for any masses, tenderness, or lesions, and then see for any asymmetry in your breaths. Good. Make sure it's symmetrical movement with the breaths, up and down. Good. And any masses, tenderness, or lesions back here as well. Okay. Now we're going to check your pulses. I'm going to start with your carotid. I'm going to have you turn your head the other way and check it here. Make sure to check one at a time. Make sure I don't make you faint. Check the other one. And then I'm going to check your radial pulses at the same time on your wrists. Make sure they're equal. And then check your pedal pulses at the same time. Make sure they're equal. Then I'm going to go for your brachial pulse near your antecubital area. Then your radial again near your wrists. Then your femoral near your groin or pelvic area. Then popliteal behind your knees. Posterior tibial near your ankles, and then your pedal on your feet. Now I'm going to check for perfusion with the skin color, temperature, and if there's any edema present on your hands. Since I'm already at your hands, I'm going to go ahead and check for skin turgor, see if there's any tinting present. Now I'm going to go to your feet, check for perfusion with the skin color, temperature, if there's any edema present there. And then I'm going to check your capillary refills on your fingernails, and then on your toes. So now I'm going to check out your abdomen. First I'm going to inspect it and see if there's any visible protrusions, any lesions, or any distension. And then I'm going to auscultate it. So I'm going to listen to all 4 quadrants. I'll listen for at least 10 to 15 seconds in each quadrant for your bowel sounds. Now that I've auscultated, I'm going to lightly palpate each quadrant. You let me know if you feel any extra pain. All 4 quadrants, and then we're going to lightly palpate over the bladder to see if there's any distension. And then we're going to do the perineal assessment, which I'm just going to verbalize. I'm going to check the groin, the genitalia, and the rectum. I'm going to check for skin integrity, any discharge, any lesions, or any protrusions. And then for the skin assessment, I would have done that throughout my physical assessment. And I'm going to check for the color, the integrity, if there's any bruising present, any lesions, any bleeding, if there's any wounds or any dressings, I'll notate that if they need to be changed. And then I'm going to check your toenails and your fingernails for the texture and the color. And I'll notate if anything's abnormal. Okay. Now we're going to do your musculoskeletal assessment. We're going to start with any deformities. I'm going to have you sit on the side of your bed, which you are doing right now, sitting straight up for me. I'm going to see if there's any deformities on your limbs or your joints. Nothing's visible right now. I'm going to have you bend forward. I'm going to check for any spinal curvature and any deformities. And then we're going to test your strength. I'm going to have you turn your head towards my hand. And same on the other side. And then I'm going to have you shrug your shoulders against my resistance. And I'm going to have you hold my fingers very tight, both sides, for equal grip strength, making sure that strength is equal on both sides. I'm going to have your legs up. I'm going to have you point your feet down like you're pushing down on the gas pedal against my hand. I'm going to have you point your feet up towards your nose. Good job. So now we're going to check your range of motion. We're going to start with your head and your neck, so just do what I do. You're going to go forward and back, side to side. Your shoulders, arms up, arms down, arms up, arms down, in a circle. And bring the elbow, bend in, and out. And your wrists, wrist down, wrist up, wrist down. And fist, and relax. And put your fingers together, and then bring your hands up as far as you can. And then I'm going to have you put your wrists out and in. And then your fingers, you're going to stretch them out. And you're going to touch your pinkies and your thumb, and then do it with every finger. And then we're going to go to your spine. So you're going to stretch your spine forward, and spine back, and then spine side. to the side. Okay. Okay. Now we're going to test a range of motion for your lower extremities. We're going to start with your hip. So with your hip, we're going to have your leg go forward and back, then out and in, and then circle. Same thing with the other leg, forward and back, then out and in, and circle. Then you're going to go for your knees, so you're going to flex your knee back, and extend, and then you're going to flex your knee back, and extend. Then go to your feet, pretend we don't have our shoes on. We're going to gas pedal down, and then turn up towards your nose. And then you're going to curl your toes, and then relax them. And then you're going to spread them out, and then relax them. And then the same thing for the other foot. You're going to do gas pedal down, then turn up towards your nose, turn in towards your body, and out from your body. And you curl your toes, spread them out, relax. You're going to spread them out, and then relax them. And I'm going to test your gait. So I'm going to have you walk 5 steps one way and then back to me. I'm going to assess your balance right now and the fact that you don't need any assistive devices. You've got good gait. So I'm going to take you back to your bed. Make sure you're comfortable and safe. Bed's in the lowest position. Wheels are locked. You have your personal belongings within reach and your call bell within reach. All my supplies are put up. I'm going to take my gloves off, perform hand hygiene, and then I'm going to document my full assessment.